Hi, it's Karen. 5 weeks post Lapiplasty surgery. My swelling has gone down quite a bit in my big toe. It's still about twice the size of the other big toe, but it's not 4 times the size anymore. I am having some issues. I don't know if it's issues, but it's I'm noticing that my toe doesn't want to move. Even when I grab it, it's very locked in. It does move some. It's not totally locked, you know. But sorry about that. But I've been trying to stretch it. And one of the big things is that tendon on the bottom of the foot that I had mentioned in a previous video. So I've done a couple of things. The tendon on the bottom of the foot seems really tight. So I'm using a really hard insert alternately in a shoe that I've purchased to replace the boot. It pushes up on the arch and helps to stretch that tendon. I have a really high arch, so I want to make sure that that tendon doesn't shorten. And the other thing is stretching that calf muscle. So pushing back, doing the traditional calf stretch, and then trying to bend the toe while I do the calf stretch and lift the heel off of the ground. The toe really doesn't want to bend that way very much. So I'm being gentle with it, but I am pushing to pain, not to excruciating pain, but to pain. And then pushing it down, which is more painful. Pushing it down is more painful. And when I try to bend it, I feel that tendon trying to cramp up on the bottom of the foot. So that's kind of tough when, to manually bend it. I mean, to bend it by itself. But when I manually bend it and push on it, then I will do that very slowly to pain. So what I'm trying to really do is hopefully at least shorten any physical therapy that I might have to go through. I don't want to wait until the 6.5 weeks is when my next appointment is. So that'd be, a week and 3 days. I don't want to wait until then for him to say, oh, your toe is locked in. Now we got to send you to therapy. I would rather start trying to see what I can do, and if I can get it, to where it's not so tight prior to going to the doctor and having him tell me that it won't move. Plus, the other thing I'm doing is I'm alternating walking in a shoe, not given to me by my surgeon, but something that I purchased on Amazon to get me out of that boot, because it was just causing my calf to get tighter and tighter wearing the boot. And that way I can walk around and be able to move my ankle while I walk and try to get that calf moving. And then the other thing I did for about 2 days, yesterday and the day before, I walked around in my toe socks with another pair of socks over top of them. But I just walked around like that and tried to walk normal. Now there was a lot of swelling under the toe joint, so it felt weird. Plus, the toe feels like it's asleep all the time because half of it is completely numb. The other half I can feel, but it just doesn't feel normal to walk on it. It feels like there's a capsule over it or something weird like that, plus the swelling. So it feels weird, and I'm trying to focus on walking normal and using the muscles normally to get me, in the right mechanics. And then today I've had the shoe on with a high fairly firm arch support to make sure and encourage that tendon to stay stretched out. So it's been interesting, and I feel like I'm, making some progress. I feel like it's getting easier to walk, and the swelling is going down. And for those of you who are into natural healing, which I am, I also have been taking an increased amount of turmeric, and I have been taking pancreatic enzymes in between meals to help with the scar tissue, and I want to see if I'm going to have some increased healing due to that. So we'll see. It's exciting. I'm getting on my feet again. I tried on every pair of shoes I own. Tennis shoes, obviously, not high heels. And I cannot get anything on my feet at this time. Even though it looks like it's almost normal size, it's really still quite swollen, and I'll show you in a video right after this. So, any questions, just ask me in the comments below. If you know anybody else who's looking into the surgery, share the video. I'm trying to help people out there that are looking into Lapiplasty, because when I did research, the only thing I could really find was the commercials that Treese Medical puts out. But if you're looking for a surgeon that does Lapiplasty, I looked on the Treese.com, and there's a find a surgeon button. I really wanted it to be the Lapiplasty, because there's also the Lapidus bunion surgery out there, and it's the same joint, but they don't use the jig that the Treese Medical had created to make it a more consistent surgery. And there's been some bad results. I've seen some videos of people that had Lapidus bunion surgery with not that great of results. So the Lapiplasty is really, now I'm going to sound like a commercial, but I don't mean to. It was a breakthrough in that type of surgery. And so I really wanted to do some research and find out if they were getting good results. The commercials, they get a lot better results than real life. And that doesn't mean I regret it. I certainly don't regret it. But I want to give an idea of what real life actually looks like after this surgery. And I want to keep everybody up to date so that you can make a decision yourself whether you want the traditional or you want to do this surgery. So that's my story, and I'll see you next time. This is the boot that I purchased on Amazon. And let me just show you. I have my foot wrapped just a little bit underneath like the doctor had recommended. And as far as moving my foot, I can't really move my toe very much. I try stretching it. Let's see here. It's about as good as it gets right now. And this is the insert that I'm using right now. It's got these little rubbery pieces inside, but this is really fairly firm. I mean, it flexes, but it's pretty firm. And I just set that inside the shoe and I step on it. I've been using raw organic shea butter on the scar ever since the surgeon let me put something on it. So we'll see how the scar does. It really I mean, what I can see of it, I haven't peeled all the scab off yet. It seems a little bit raw underneath still, so we'll see. Here's my feet at 5 weeks post Lapiplasty. Still swollen. I can't really, well, I can move it some, but it feels restricted of movement. It doesn't feel too painful. I mean, every now and then I get some strange feelings, but that's as far as I can bend it and lift it. It's looking pretty good though.